Okay, we are back this week, and this week we're going to talk about why we started our business and the whole process of starting the business.
Yes, pretty good, cool topic, right? Because the blueprint usually is, hey, get into medical school, then, do well on your boards, your exams, and then you're going to go try to get into a competitive specialty, do residency, and then specialize further if you do fellowship, and then go out into the workforce. And so fast forwarding kind of all of the training we went through, and then we had the decision to make, do we want to go into the workforce and work for a large company, more established company, and just focus on, the practice of medicine, or do we want to create our own path, do our own thing, and create our own business? And why did we do what we did?
I think there were a couple different factors. I think the time during fellowship and the few years practicing after training showed us that to some degree, if you don't open your own practice, you don't have full control over certain policies and how things are communicated to patients. So I know in my old practice, people would call really frustrated with some of the financial policies, for example. So I think it is helpful to have control of what your policy is and how it's communicated to patients. And there still may be a rare person who's unhappy, but you do your best to make that as smooth, seamless, transparent as possible. And also have control of the culture of your clinic and the values of your clinic. So for us, I think big things were putting patients first always, having a nice kind of workplace culture.
I mean, I think one of the real reasons we also looked at it is because of earning potential, right? I mean, we worked our tails off to try to get to where we were and where we are. And ultimately, it was like, well, I could make a lot more money doing this myself, right? Do you lose the safety net? Yeah, but we're really good at what we do. We can help a lot of people, and we want to be compensated for our time, right? Because one of the biggest things when you become a physician is you really have to trade your time for, your earnings, right? And that's a difficult thing to kind of grasp with, because if you're doing really good work and that's paramount, that's first and foremost for your patient care, that's awesome. But if you're not getting, compensated for what you think your value should be, you're just going to be disgruntled and frustrated. And that, I think, leads to burnout. And so for us, that was like, hey, let's try to forgo that. It's going to be tough because, we're walking away from the opportunity to have pretty good money after a long waiting period. And I think you should probably talk about that, because that's something we talk about all the time. It's like delayed gratification. Mm-hmm. It gets thrown around a lot, but I don't think a lot of folks outside of the career of being a physician or even a long-term professional, they don't really understand what that means, right? So like, I'm in my mid-30s, but I'll let you talk about that.
Yeah, I mean, so throughout medical training, you have to make a lot of sacrifices, miss family events, traveling, when people are enjoying, a really fun part of their lives, and you're making all these sacrifices, studying. And then I think that is part of the reason, and also probably student debt is part of the reason why a lot of people coming out of residency or fellowship or the final stage of their medical training decide they're just going to go work for someone, because it is definitely a short-term step back in having your own practice. If you go work for someone, you're a lot of times guaranteed a salary, or even if it's productivity based, you're walking into an established practice, so your earning potential is going to be a lot more, versus starting your own clinic. You are, starting from scratch. You're probably going to be losing money or not making a lot for an extended period of time, and it's also a huge risk. Most people who go into medicine may not be big risk takers. Otherwise, they may have chosen other career paths from the start. So I think a lot of people just like the guaranteed kind of safe aspect of working for someone else and don't want to take that risk.
Right. Yeah.
And it is definitely scary. And we have also days where it's like, well, is this really worth it? And the answer for us is definitely yes. And I think for me, a lot of it is not the money part of it. It is all those other things. So like being able to have control of always putting patients first, having control of our work environment and culture,
Your
and making,
schedule,
yeah,
right?
your schedule. That's another huge thing too.
That's huge. It's huge. We get to call the shots. Like in our first year, we were fortunate enough to kind of make the decision that this is going to be a marathon, not a sprint. We got an opportunity to go to the World Cup in the Middle East. That was awesome. In maybe 7-8 months after starting, and from a business standpoint, maybe not the best decision. You shouldn't really leave your work for like 10 days. But that was the first break we actually took after over a year of working on pre-start and then 7 months of actually starting the business. And those are kinds of things that like we could say, okay, you know what, 2 physician practice, let's both leave, as opposed to if we were working with someone else or for someone else rather, there's no way they would, approve that. So I totally get that, but it's a daunting task, right? Like there's no protocol. And when you're doing something very niche, like what we're doing, we're not a dermatology practice that takes insurance. We're not internal medicine practice that takes insurance, right? Folks don't need to come to us. There's no emergency when it comes to hair transplant or restoration. So it's like, how can we go ahead and create this practice, brand it beyond just ourselves, maybe, and then how do we market, right? How do we tell people that we're here and we're good at what we do, right? And I think I want to like give a shout out to one of our mentors, like our attending during fellowship, Dr. Matt Levitt. He was really, really helpful in kind of showcasing, what it takes to be a really, really good physician within the hair restoration surgery space, but also kind of the intangible things, right? Things they don't teach you, like how to run the business side of it, right? Because we are woefully underprepared as physicians coming out of training and residency and fellowship. And so kind of seeing that was awesome. And his, kind of saying and motto was basically a rising tide lifts all boats. And we've really felt the same way about helping others. But that's really what I want to discuss with my part of, the conversation today is like, there's a lot of people out there that would love to be, in a position we are, because it's awesome to be able to call your shots and run your own practice. But a lot of people don't do it because, it's scary. And so it can be done. And hopefully we can lay out a little bit of the blueprint.
Yeah, it can be done. And it's also, there is some ongoing stress as well.
Right.
But I think it's worth it if you value, again, having control and that flexibility, basically.
Right.
But yeah, we can go through kind of how we were able to do it and the steps.
Yeah. I mean, idea is the first thing, right? Like ideas can be awesome, but you got to be able to execute, right? Mm-hmm. And so our idea was, well, let's be the quintessential version of a hair restoration practice, a true institute. It's in our name, Root Hair Institute, because we push forward with, evidence-based treatments, and we're very academic. You are one of the co-directors or co-editors rather of the journal within the hair transplant kind of space. So those things are super important and kind of allow us to be at the forefront of the technologies and the treatment offerings that we offer, right? So I think that was our shtick. We said we don't want to be a jack of all trades. We don't want to do all kinds of aesthetics, cosmetics, etc. And you being a board certified dermatologist, even that's a hard decision to walk away from skin, which is like the bread and butter, into something that's a little bit more niche hair. Because you do both medical complex hair loss care and surgery. I just do hair transplant surgery with my background. But finding the idea was super important. I mean, would you disagree?
Yeah. So I think I guess the first step would be the why.
Right.
So the why for us, I think, was a number of things. It was in terms of, and I think we talked about this a little bit in episode 1, but in terms of why we opened our own practice, I think we went through that. in terms of why hair. I think we touched on that, but the artistry of it, the time you get to spend with patients, and then coming from a derm background, seeing people that aren't being taken care of, because there is kind of this division of the dermatologic side and the hair restoration side. And then in terms of our why of opening it in this location, I think that was a huge thing too,
Right.
is you need to know the market and you need to know basically what you're able to offer that others are not. So
Right.
that I think was encouraging, that we were going into a place where the entire region didn't have a derm with hair restoration surgery all under one roof. So that was really exciting. And there's proof kind of in that concept of the need there, because we have been able to be successful.
Mm-hmm.
I actually was just talking to a Mohs surgeon in town, and he was saying that it's really nice that there's a derm and hair restoration surgery practice to send to.
Right.
So both from a patient perspective and from an other doctor perspective,
Right.
I think there's value there. So I guess in terms of making, not just talking about us, but how do you translate that into other people being able to find their why? I think it's kind of figuring out what you're passionate about, what you want to do. And if you value just being able to show up to work and you don't want to deal with staffing and, compliance and all the other things, then maybe the answer for you is you just go work for someone. But if you're valuing other things that you're going to find in opening a practice, then, that's a good reason to do it. And then you need to kind of think about what it is that you want to differentiate yourself with.
Right.
How are you different? Are you offering something different? Because if you're not, then you're kind of setting yourself up for failure from the beginning.
Totally. So, I mean, then moving on from why to like what, right? Like, what do we do, right?
Mm-hmm.
And so in hair, there's so many things that are, marketed as the best thing since sliced bread, right? As far as hair loss treatments go. And unfortunately, that leads a lot of folks astray, right? So you pop open Instagram, TikTok, you've ever talked about hair loss, you're getting targeted by the next best product. And I use best with quotation marks. Ultimately, it's one of those things where patients have tried so many things, our patients have tried so many things, and it's led them down this path where they're frustrated because their hair loss hasn't stopped. So we said, okay, well, our what is, let's bring it back to the basics. It's like, let's actually see all of our patients, right? Which is funny that we have to say that, but a lot of practices don't, or you don't have enough face time with the physician, or even a physician extender, nurse practitioner or physician assistant, like the treatment team. And that's a problem, especially when it comes to hair loss, because it's a very personal topic. It's very, causes a lot of distraught to a lot of people. And so that's our basic what. And then I think we decided, well, what are we going to offer, right? When there's so many things out there, I want you to touch a little bit on that, like why we decided to be very, very focused on our offerings.
Generally in this field, there's a lot of just focus on kind of marketing without the evidence to actually back things up. And it's really not nice, not fair to consumers, and they get really lost and they end up wasting all this money on things that don't work. So I think that was a huge thing to us, was we want to be evidence-based. We want to offer things that, medically make sense and also have data behind them to back them up. And so that was really helpful. And we also want to be transparent about the different offerings, different options, what the benefits, what some of the risks of different treatments are, to help educate people so that they can make the best decision. So I think that's part of it, is when we talk about what we offer. Yes, part of it is the different services that we offer.
Mm-hmm.
So for hair, we have diagnosis, which is a huge part missing too from a lot of different places, as we actually, diagnose what type of hair loss. If there's potentially contributing factors, we help work that up.
Yes, and just to segue really quick, there are multiple types of hair loss, right? You just hear the term alopecia. Not all alopecia is created equal. It just means hair loss, right? There's different kinds in the double digits of the type of hair loss. But yes, go ahead.
Yeah. So in terms of offerings, again, there's kind of the services that we offer. So the diagnosis part of it, which is missing from a lot of practices, the workup part of it. And then once we figure out what type of hair loss and why, then we have a lot of different things. So like topical medications, oral medications, depending on the type of hair loss, red light therapy devices. And then we have some in-office treatments like platelet-rich plasma, so growth factor type injections, as well as hair transplant surgery. And we offer both types of hair transplant surgery, which a lot of places don't do. There are certain scenarios where you want to use each of those things, including the two different types of surgery. And there's also, different types of people where those different treatment modalities may not be appropriate for every case based on medically what they look like, but also their lifestyle and their preferences. But if you only offer one thing, in medicine, sometimes we'll say it as if you only have one thing in your toolbox, like if you don't have a screwdriver and a hammer and a drill and all these different things, you only have a hammer, you're going to hammer everything. And we didn't want to be someone just pushing something because that's the only thing they know how to do or that they offer. So we really wanted to have a diverse toolbox to be able to offer the best kind of care. So that's that part of it. But I would also argue the education part of it is something.
That's the other what,
right?
for sure.
That is the other what. So we actually take the time to educate patients on the different treatments, what's appropriate in their case. Again, what, the benefits are, what the risks are, those kinds of things.
Yeah, with the slew of misleading advertisements that are out there, folks get so confused. Mm-hmm. And so level setting and bringing them back to hey, this is what's actually happening. This is what is out there, and let them make the decision. Don't push them towards, certain things, but give them the control to do so.
Right. And we still want to give hope where there's hope. But if anything, I often undersell, I would say, because I want them to, for us to exceed their expectations.
Right.
Rather than promise something and not be able to deliver it. And that's very different than I think a lot of the market out there in the hair loss and hair restoration space, both in terms of products and surgery.
Right. For sure.
So you have to, I think that education part was a huge thing for us.
Right.
But yeah, I think the what part of it is super important. Like, what are you doing and why are you different? And
so we know the why and we know the what. The how is something that we should definitely talk about. And this is a multifaceted thing, right? So the how, I think we can explore where we chose, that would go in technically to the where, but we were coming from the other side of the continental US, from one corner to the other, right? So we moved directly from Florida. And then I think we should talk about how we decided to put our names out there, right? And the branding aspect of it and, the marketing. And then the how of the operations, how to build it, right? Because that's really, really difficult with our backgrounds, just being, in systems that were already working and you just are a cog in the wheel. Whereas here, as our own practice, practice owners, we had to create the system from scratch. So jumping into it. All right. So how did we find the place that we chose?
Yeah. And we touched a little bit on this in episode 1. But basically we had, a lot of mountain type of places that we were looking at versus moving to Houston. Then we started visiting here because my parents had moved here and really liked it. I tend to like really calm places. If it were up to me, I would live in the middle of nowhere in a cabin in Montana, and you would live in Manhattan if it were up to you. So this was a good kind of
mix
city with nature type of situation for us. But we weren't going to just go somewhere for that. We needed to be able to be successful in opening a practice. And it had to be able to compete with Houston, because in Houston, we both had a lot of connections. I had trained there. I knew a lot of dermatologists there. I knew a lot of people there.
Right.
Versus here, we didn't really know anyone besides my family.
Yeah.
So
that was definitely our anchor that we were, or the benchmark rather, that we were going to compare everything to. So I remember like one of the ways we were able to figure out how to do this was to first just do market research on our own, right? We didn't, go anywhere. It was so niche. We couldn't ask a consultant to do this kind of work. We knew the field. We knew who the other quote unquote experts were in our demographic area, or rather geographic area. And we said, okay, let's just put on Excel a list of these folks, and anyone that offers anything related to hair, let's just capture that information, figure out what city they're in, what jurisdiction they're treating, and we'll go from there. So I remember doing this with you for Houston market and the greater Seattle market, because we didn't know we wanted to be in Bellevue. And so that was like our first reasoning to say, okay, this is a not a very large market. It's I would say above average, medium market, but it doesn't have a ton of competition. So it's something that we could see, ourselves doing. And we did figure out the demographic, right? And we'll go into that as far as who our target demographic is in a moment. But that was the first foray. And so I think we know what we know. So then we said, okay, from over 1,000 miles away, how do we find the right place? And so that's when you have to get an expert involved, right? And so we were fortunate enough to have your family know their realtor for their home, who of course doesn't do commercial, but through her, we found a commercial realtor. Mm-hmm. And that was great because we got on, the ball with that. And we said, okay, where should we be? When you hear of Seattle or LA or Houston or New York City, like it's not just, hey, here's the city, everything is the same. There are different, divided areas within that greater metropolitan, and they're known for different things. And so we thought we wanted to be in Seattle. We looked at like 30, 40 places virtually, and we took several trips up here to look at places too, just to see what felt right. But having a good realtor that understood our vision and kind of like from a 10,000 foot, overview, the strategy of what we're trying to build. And he was really able to help us kind of identify, hey, this is the right place for you. Mm-hmm. Right? Without him, I don't think we would have been able to do it properly.
Yeah. So I think in our experience, essentially the background research of figuring out if a market was right, we felt comfortable doing. And we were able to do that with looking at, different demographics of areas. One of my friends who's a dermatologist taught me kind of the trick, which I do sometimes too, is like looking at Whole Foods or Trader Joe's in an area. He's like, well, they have, all of that.
Yeah.
Smart. All those,
it's actually really
all
smart.
All those resources to know where to go. So that can be helpful if your target demographic does need to have a certain amount of discretionary income.
Right.
So that was something helpful. And then really just, breaking down by service. So not just people focused on hair restoration, but how many plastic surgery offices are dabbling in a little bit of hair too. So we felt comfortable doing that. But when it came to finding the space, the commercial realtor was really, really helpful. And we feel very confident in our decision of where to be. And I don't think we would have made the right decision without his guidance. 100%. And we listened though. 100%. We were stuck on being in a certain area.
Yes, please be adaptable when you're doing this, right? Because you're not an expert. You're an expert in whatever your field is. But listen to the people you're paying to advise you and take their advice.
Yeah, because if we would have been stuck, our vision was we were going to be in this big high rise in downtown Seattle.
Yeah, that would have been a mistake.
Yeah, and then, parking was not ideal. Safety was an issue, all kinds of different things. The building I really liked with the best view
had mold or something, right? That needed to be removed.
And then the
risk of asbestos.
They came and told us, you would have to come do the renovations like through a crane, and then they might find asbestos in the walls because I guess anyways. So I think you have
awesome view though,
an amazing view of Rainier and the water and everything. But I think you have to be open to changing your mind and your vision when information and the experts around you are telling you something different.
Right. Quickly kind of segueing into the how for the operations, right? So like we had to figure out how do we, design displays? How do we create, a list of items to buy, supply, equipment? And I think for that, like, you have to do the legwork to find the correct vendors, and you have to create a list and then start engaging with them early and refine your list and maximize your list, right? Because you don't want to come up short, especially on your budgets. But it created the list, and then we bid it out. We said our philosophy is you have to have at least 3 bids, right? And out of the 3 bids, you're going to see who the best is, and you can tell a lot, right, from that. Don't go with the cheapest person quite necessarily all the time. Like, go with the best customer service or an amalgamation of all of that. And so we decided to go through with our vendor, and we pretty much buy 99% of things from that one vendor. And then when we did the specialized hair specific or hair restoration surgery specific stuff, we kind of did the same thing. So that, is very difficult to do, but it is possible. And a lot of times these vendors have created these lists for other people in the past. So they'll be happy to share it because they know they're going to gain your business if they, are prompt and responding to you and helping you start your own. So definitely take advantage of that.
And you still have to think through it, obviously,
Of course.
because you do things differently.
Yeah.
The way you do procedures is probably different, so you have to do that. But I think that was one of the most memorable moments for me, actually, in prepping for opening. Was we were in a coffee shop in Tacoma, and because that's where we were staying temporarily, and we had to go through and figure out our initial medical supply order before we'd opened. I was getting so stressed out because it's really hard to do. You can't actually like see the products. It's not like you get to go shopping at the medical supply store. So from the descriptions, you might order some of the wrong things. And I tend to be a perfectionist, so I wanted to get like 100% on this assignment. And you had to tell me like, hey, this is going to be, or even with the budgets and doing that, you're like, this is going to be like 80, 90%, like an 80% on the business side of things. Because an 80% on the medical side of things is not okay. We aimed.
That's a B-.
But not just in grades, but in delivering like care. You got to be on point.
Yeah.
You're going for 100%. And that's the way it needs to be. But on the business side of things, you can't operate at 100%.
No, you're just going to have...
There's too many variables. You have to take
analysis paralysis.
Right. You have to take all the variables and do your best and then adapt as you get more information, as more numbers come in.
Right. Yeah. 80 to 90% you should plan for. If you're doing less than that, then you're going to fall flat on your face unless you get super lucky. But 10 to 20%, you cannot account for. You have to let it organically refine your vision. And that's totally fine.
And it continues to change too.
Exactly.
So then you have to be adaptable. But I think that was one of those moments where, for at least for me, it seems like an obvious thing, but coming from medical training and medical education, I was like, oh, wow, I cannot, get this 100%. I'm going to have to, aim for 90%. And we actually did an amazing job on that first order.
Yeah, we were told we got 99% of the things, which is pretty cool.
Yeah.
Pretty cool. So then segueing into the how of a little bit more of the operational side, right? It's like, okay, we had to find people to, hair transplant surgery is not just a one person task. You have to have a large team. And, whenever you have your own practice, you have to think of receptionist / front desk. You have to think of manager. You have to think of someone that's doing sales. You have to, and we could do a whole episode on kind of just the how of creating the operations. But I think figuring out. And
I'm just going to mention medical assistants and hair technicians.
Oh yeah, 100%. But that's what I meant by the team. Yes, totally. The folks that we came across in a new location that we were not familiar with, I was really scared about that, to be honest, right? Because this is why I was like, okay, maybe we should just do Houston because we can find people to work with that we can trust, that we can train. And that was the hardest thing here. And I said, you know what? We don't have much to lose. So I started contacting anyone I knew. And I said, hey, do you know anyone? These people would be in Florida. These people will be in Texas. And I'd be like, do you know anyone moving to Seattle or lives in Seattle or greater Seattle or Portland or Vancouver or like anything nearby? Like, can I poach someone? Can I take one or two people that are out there that may not be employed or working somewhere else, or looking for a better kind of lifestyle, position, work culture, etc., pay, and can we take them on our team and show them the vision? And we fortunately were able to come across two people that had over a decade of experience each. It was awesome. And we said, okay, we're going to build around these two people a new list of folks that we're going to then train up from scratch, right? And so then I remember using a lot of brands, and then I ended up just finding a ton of people on Indeed, right?
Yeah, because we looked at some recruiting companies and for medical assistants, and they basically, the cost of a medical assistant through them, and they weren't even experienced in hair,
right,
was going to be equal to like a physician assistant or something crazy, because they are taking all this.
Yeah. So that is something that I think is really, really important and probably the most difficult thing. But that's how we did it, kind of a high level overview.
And it was trial and error too. I mean, you don't want to think about personnel in that way, but I think naturally the people who fit with our culture, who wanted to be the best, who could take feedback, who really cared about patients and delivering the best care, and also just wanted to come to work and get along with people and have a good time at work, have a positive work environment, those people stayed. And the people that weren't a great fit naturally left. We didn't let anyone go. They naturally left. Right. And other people left for other reasons too. It's not like everyone that ends up, any turnover that we have, anyone that left, it wasn't just that they weren't a good fit. There's also life that happens and things like that too.
Of course.
But I think that also, if you are a perfectionist type of person, you want to get it right the first time. You want your first round of hiring to be perfect, and you're never going to have to hire again. And that's just not the way that business is. I mean, even if you retained everyone and, you and the person you're hiring both assessed if it was a good fit or not, and everyone stayed, if you're growing, you're still hiring. So I think that's another thing, again, where you have to be okay with the fact that businesses evolve. You're not going to get things 100%. And naturally, things a lot of times will fall into place. If people are not a good fit, they're going to kind of figure that out too.
Yeah. And on that, like when it's not the right fit, or someone decides to like not show up for work and they quit, on the spot or something, not that that's happened to us, but when those things do happen, the first time it's unsettling because you're like, oh crap, what am I going to do? The second time you're prepared. The second time you're like, okay, I've been through that before.
It's still stressful.
It's stressful, but it's again, it's not, you're not like taken aback. You're like, oh my God, how can this happen to me? Because you would never do that. Right. And that's something as like a clinic owner, as a physician entrepreneur, it was very difficult to understand the first time. And then now, you roll with the punches.
And you also find a really good team.
Yes.
That is like professional and is responsible, but you kind of have to go through some growing pains to,
and that's fine.
To get there.
And then the how of finding, patients, right? We know our who, right? Our demographic is anyone that's looking for hair loss. And we don't really, we don't treat children, but anyone really over the age of 17, 18, all the way to 80, 85. We have patients that old too. Men, women, transitioning patients. We are okay treating any type of hair, any kind of curly hair, straight hair, Asian hair, Caucasian hair, ethnic hair. I think that was really awesome, but very difficult to market, right? So then we had to figure out a branding scenario and a marketing scenario and marketing channels, right? Like, are we doing Google ads? Are we doing radio ads? Are we doing TV ads, billboard ads? Are we doing social media? And that is like a really, really deep dive topic we should do because a lot of folks get this wrong, especially in healthcare. And you have to understand that you have to figure out what your business model is. And we realized early on that people do not need to come to us for emergencies, and people cannot use insurance for their treatments. So they would have to pay a good amount of money to see us and do treatments with us. Okay, so then that is in the realm of, hey, market yourself possibly on Google and differentiate yourself rather than your insurance, you're in network or something like that, right? So,
but that's going to depend on, the type of business and even the specialty in medicine. Like, my cousin is a psychiatrist and she finds Google ads to not be helpful at all because that's not the people Googling for a psychiatrist are not her target demographic whatsoever.
Sure.
So I think it depends on your specialty, your demographic, a lot of different things, but you're absolutely right. That's an important step is finding what that means for you. And it might take some trial and error as well. Like we recently actually cut back our,
we
Google spend.
reallocated our budgets and we're doing social media. Right. And so if you're seeing this, we're doing more social media and it works, right? I mean, there are different types of people that ingest different kinds of media, and you have to figure out with a pulse on your practice, like where they're coming in from, and then try to double down.
Yeah. Especially at the beginning, at some point we already have a good amount of like word of mouth that builds and a good amount of referrals from other doctors. But as you're a more established practice, that builds and builds to the point where a lot of times, if you've been in practice for 10 years doing great work, you may have a 6-month, 1 year, several year wait list, right?
Yeah, totally true.
And at that point, you probably are not interested in advertising.
No, totally.
But at the beginning, even if you're doing the best work, which, we do and believe that we do, if you haven't been in practice that long, you have to be somehow letting people know who you are, what you do, why you're different, because not enough organic kind of buzz about you has been built yet. It's coming, but it hasn't come yet.
Those were the roller coaster, let's say, weeks and months that we used to have. And it's more so me because I'm more of the financial guy in our practice. And so like I always have to figure out, okay, this is how much payroll is, this is how much our overhead costs are, right? Which includes marketing, it includes, rent, et cetera, supplies. And this is how much business is coming in. And it doesn't always correlate, right? Like you can get trends, but when you're micromanaging everything, it's really easy to be hyper-focused and, be really elated when things are good and really upset when things are bad.
Almost too reactive of like, we need to change things. But like, okay, maybe that was just an off month. Maybe let's give it a little more time before we change, the Google ad spend or
a good general idea is like play with kind of something for about 6 months, right? 1 month is definitely not enough. 3 is probably still too little. 6 is a pretty good indicator you're doing something good and double down on it, or hey, it didn't work, let's go back to the drawing board. And that may mean the idea, the tactic, the vendor, the partner. We don't do a lot of these things in-house. We know what we're experts at. I'm not a Google ads person and I'm not a social media person. I don't care about that stuff because I should say I do care about that stuff. I just don't know how to do it, and I don't have the time to learn it.
You don't care to go into learning it because you have other things you need to learn.
Because if I did that, then I wouldn't be a physician.
Right.
I wouldn't
you
have
want
time
to spend time on learning like the newest techniques of hair transplant.
Exactly. So like find your vending partners and be good about kind of respecting them and their effort and give them enough time to do what they're doing, but have that philosophy and be open with them. Hey, if this doesn't work out, we're going to have to part ways. And we've had to do that. We've had to do that a few times. But I think we're better for it. And going into our 3rd year, I think our processes have refined. We just actually came off our best month yet, which is pretty awesome. So yeah, things take a while to work, but when they start clicking, you're like, okay, this is all worth it. So then, kind of going into just one quick thing, it's like, why would you do this again? At 3 years, like now looking back at it, right? Because we were always comparing the benchmark of, I could have worked for someone else.
So that's like reflection.
Okay, let's reflect.
We did our why, right?
Sure.
We did our what. We did our how. Did we finish our how?
I think there's like a deep dive into the how, and we should break that up because you're going to be here for several hours.
Yeah. But I mean, I guess in terms of, so for you, you come from an entrepreneurial family. You'd been involved in other businesses. So
Right.
for you, it wasn't
In parallel, actually, while we're doing
right.
this.
So
Yeah.
it's not some crazy, you're doing commercial real, you do other things, but it wasn't foreign to you to be looking at P&Ls or to be coming up with a business plan. But for someone who doesn't have that experience, do you have any? Because for me, it was like,
that's
my
a good
business
one.
plan is that I have a good business partner. And I'm going to focus on being a doctor and compliance things and the things that I'm good at and writing. And but for someone that doesn't have Rahil Roopani as a business partner, what would you recommend?
I think the world is your oyster when it comes to learning and education, right? So like you can go on YouTube and find, long format, short format videos to just take pearls of knowledge. You can get on courses. You can read books. One of the things that I have really, really relied on is I have a group of friends that just happen to also be entrepreneurs, right? And you don't have to have a group of them. You lean on one or two of them and you just get them to butcher your ideas or, give you honest feedback on what is going well, what is not.
Talk on
Pep
a
talks.
rough day.
Yeah. And I'm constantly badgering them. I'm like, hey, we're going down, the ship is sinking, I'll be super dramatic and I'll call them and they're like, you're dumb. Like it's fine. And it totally turns out to be fine. And they're, 5 years in, 10 years into their own businesses. So they've felt the way I feel now,
Because
or you and I feel now.
they weren't busy doing med school and residency, so they have more established businesses.
Exactly. But from a business standpoint, they're like, okay, well, look, this is normal in your first year. This is normal in your, third year. It's gonna take you 5 years to get here or 10 years to get there. And so it's always nice to have a little bit of an idea of what to expect. And being in business as a physician entrepreneur, and when you don't have any bosses to answer to, and you're the boss, basically, it gets lonely and it gets scary because if things go well, that's awesome. But as you grow as a practice, and now we have 13 team members beyond just us, those are 13 individual families that RHI is providing support to. And so you don't want it to fail, not just for yourself at this point. You don't want it to fail for any one of them either. And the stakes just got higher, right? And so like having that pulse, super important. But that's not to deter anyone. That's the fun part about like building something that can really, really be a game changer for a lot of people.
So you're saying some type of resource, whether it's books, YouTube, courses,
but people like friends,
but then also
friends, join networks.
Friends.
There are a lot out there and you're not going to find you may not, find another physician entrepreneur that's in the same boat. You may, right? But it doesn't have to be the same field. It just has to be someone that can kind of look at it, your scenario at least, with, without any biases and just tell you, hey, you're doing this right, you're doing this wrong, or this is what you should do.
If you did want it to be the same field, I think like conferences and those kinds of things are really nice too.
If you're starting out a hair restoration surgery practice, reach out to us. We'll be helpful. So
go to the ISHRS World Congress and meet people and all that kind of stuff. Yeah.
Yes. All right. So
okay, now we can do reflection. Sorry, I wanted to make sure we finished how.
Yes. This is good. You're always keeping me, organized. And so that's what you should do. You should have a partner that keeps you organized or someone in your team on your team that does. Reflection. So reflection for me, I love it. I think you mentioned a little bit about like, hey, you come from a business entrepreneurial background within, my family. They're all entrepreneurs. But I haven't gone to business school. I have never started my own business. So I'm business adjacent, right? And so like you can't fake it till you make it kind of deal. So this is my education. This is the version of what I can create.
But you'd been involved in a business before.
Totally. But like when you're working with a bunch of partners and you kind of separate, your tasks and what you're responsible for versus when everything falls on one or two people, totally different, right? Especially when you don't have anyone to answer to, because that's scary, because you're like, okay, well, you can only point the finger one way, and that's at yourself. And so that is like scary, but that is the true essence of what we're trying to do. Like, we're trying to not sugarcoat anything. We're trying to send a marketing message to our patients that we feel as physicians is accurate, right? And true. And so we're trying to bring, and meld the business side and the physician, practice of medicine into one thing. Whereas I think that's been kind of muddied, let's say, over the course of so many decades in other fields and by other big practices and whatnot.
Yeah, because you have non-physician owners who are calling a lot of the shots. So we wanted to, again, have our practice be physician-owned, controlled by us, so that the people in control are the physicians taking care of patients who are going to put patients first.
Right.
But yeah, for me, in terms of reflecting if it's worth it, it definitely is. I think sometimes you have days where there's stress, right? Because I have worked for someone before, and I know that experience where I would show up to work, do my notes, go home. And if someone called out, that wasn't my problem. The manager was going to figure that out. And I didn't have to worry about anything else. I didn't have to worry about payroll, the stress, if the business was doing well or not. Truly, I was just a doctor, and that was it. So I've had that experience to compare it to. I got frustrated in that situation because, again, like we talked about at the beginning, I wanted more control over policies and to be able to make sure my patients had a good experience from start to finish, including the non-medical aspects. It definitely is worth it. I think just, the journey of it, knowing that we have all these people that we are providing for, all these families we're providing for, that we're doing the best for our patients. It really is worth it. It's just, there's rough days where you're like, okay, should I have just gone and worked for someone and not have to deal with any of this?
Yeah, that's totally normal.
But that's normal.
And you can have an awesome day as a physician with good results and everything like that, and then a terrible day with a different hat on, meaning like, hey, marketing's not going well, or you have to hire someone because someone just like departed your practice. Yeah, it's totally fine because you're wearing so many different hats and you're focused on so many different things. But that gets better too, because systems get created. Yeah. And as a team grows, you start outsourcing within your team handling of certain facets.
Right.
So I think that's a perfect stopping point. And I think we can jump into one of these topics a little bit more in the future. But for anyone that's out there looking to be a physician entrepreneur, it's totally doable. Don't be scared. It's not easy, but you're used to hard work. So that's that. And
for those of you who didn't know, I'm Dr. Natalie Kash. I'm a board-certified dermatologist and hair surgeon.
And I'm fellowship-trained hair restoration surgeon, Dr. Rahil Roopani. And we are Dr&Dr, so subscribe. We'll see you at the next one.